The quiet victory. How public health nearly eradicated smoking in America for many, the image of smoke-filled restaurants and ashtrays in airplanes is a distant memory. Yet, less than 60 years ago, these were commonplace. Today, less than 10% of American adults smoke cigarettes, a historic low marking one of the greatest public health triumphs of our time. This isn't the result of a single miracle cure, but decades of relentless effort. Science, policy, litigation, and unwavering determination against a powerful industry. From ubiquity to rarity in 1965, over 42% of American adults smoked. By 2024, that figure plummeted to 9.9%, the first time it has fallen below 10% in recorded history. Consider this: in 1980, a third of American adults still smoked. The infamous Joe Camel mascot debuted the same year, directly targeting children with addictive products. Now, smoking is officially considered rare in the US. This decline didn't happen by accident. It was a sustained effort that chipped away at the problem despite fierce resistance from tobacco companies. These companies spent billions on marketing, actively suppressed evidence of harm, and lobbied aggressively against regulation. The consequences were devastating. Over 20 million Americans have died from smoking-related causes since 1964, with approximately 480,000 deaths annually. Globally, tobacco killed 100 million people in the 20th century, more than WWII. The turning point. Facing the truth, the pivotal moment arrived on January 11, 1964, when Surgeon General Luther Terry released a landmark report linking cigarette smoking to lung cancer and heart disease. This announcement, strategically timed for maximum media coverage, hit the country like a bombshell. Yet, the industry fought back, concealing internal knowledge of the dangers for decades. A notorious internal memo from R.J. Reynolds summarized their strategy: "Doubt is our product." For years, the tobacco industry funded fraudulent research, lobbied Congress, and targeted children with advertising. In 1994, tobacco CEOs testified under oath that nicotine wasn't addictive, despite internal documents proving otherwise. The industry remained undefeated in over 800 lawsuits until 1998, when 46 state attorneys general secured the Master Settlement Agreement, a $246 billion settlement, the largest legal redistribution of corporate wrongdoing in American history. In 2006, a federal judge ruled that tobacco companies violated the RICO Act, typically reserved for organized crime. How smoking was beat. A multi-pronged approach. No single policy eradicated cigarettes. Success came from a combination of interventions deployed over decades. Warning labels, 1965, broadcast advertising bans, 1970, smoke-free workplace laws, starting in 1975, growing awareness of secondhand smoke, 1986, progressive tax increases, FDA regulatory authority, 2009, and cessation programs. Perhaps most crucially, smoking transformed from a social norm to a banned activity in many public spaces, reshaping societal attitudes. The results are staggering. An estimated 8 million lives saved between 1964 and 2014, equivalent to 157 million years of life. A 40-year-old American man in 2014 could expect to live nearly 8 years longer than his 1964 counterpart, with roughly a third of that improvement attributed to tobacco control. The fight isn't over. Disparities and new threats. Despite the progress, challenges remain. Smoking rates persist among those with lower education levels, 42.8% among GED recipients, low-income Americans, 24.4%, rural residents, 27%, people with disabilities, 21.5%, and workers in high-risk occupations, around 29%. Smoking has become increasingly concentrated in marginalized communities with limited access to resources for quitting. Furthermore, nicotine hasn't disappeared. E-cigarette use holds steady at 7%, with vaping filling the void for younger generations. While vaping is less harmful than smoking, its long-term effects remain uncertain. The progress is also threatened by dwindling federal support for public health initiatives. The CDC's Office on Smoking and Health responsible for tracking and driving this progress, has been gutted by budget cuts, forcing independent researchers to fill the gaps. A global imperative, the US success story isn't universal. Approximately 80% of the world's 1.3 billion tobacco users live in low and middle-income countries, where consumption is rising. Tobacco kills over 7 million people annually worldwide, a number projected to reach 10 million by 2030. While the 20th century saw most tobacco deaths in wealthy nations, the 21st century will witness a surge in deaths in developing countries. The lessons from the US are clear. Sustained, coordinated action can overcome seemingly insurmountable odds. From 42.6% to 9.9% in 60 years, 8 million lives saved. This is the power of long-term, evidence-based public health policy. The ashtrays are gone, smoking sections are relics, and a new generation breathes easier. This isn't just a story of decline, it's a testament to what progress looks like when it's relentlessly pursued.